So I'm just gonna tail on a tiny extra question there because you've spoken very insightfully about your feelings across these different geographies as a function of language, as a function of interpersonal connection. I'd like to just press you to, if you can, if you've been able to capture this in some way, whether there is a difference in expectation about the care that one would receive in these different places, and whether or not touch specifically, but also maybe this interpersonal connection is expected in varying degrees across these three very different cultures. So I'd be curious if you have any insight. Maybe you've been treated in these three different places as a patient, and whether you could speak to the patient side of the equation and what those expectations might be.
Yeah. Uh, yeah, but my mind automatically goes to seeing the bigger difference that I see, or perhaps the biggest difference that I see in terms of uh, how much touch gets done in these settings, more so than geographic. And I know for the first question, it was more of a temporal relationship that I saw. For this question, I see that it's more so has to do with perhaps the best term is not social class, but depends on the setting in which you're getting care, right? So in the private system versus a public healthcare system, in a humanitarian context versus a private hospital context, the expectations that patients have and that I can have. No, I'll speak a little bit about my experience so far in Austria, which is a very new system to me over the past few months, really. And on a personal side, I've going through pregnancy, and then I've rarely been a patient, and then having to cope with being a patient and realizing how touch is quite different in this setting, and I had not experienced medical care in Austria before, and seeing that even in pregnancy, there is a very um, there's a sort of barrier that's always there between the patient and the physician, and touch is not part of the care provided even in pregnancy, right? It's the patient has to ask for it, has to ask to be examined, unless it's part of a checklist that the doctor has to go through, which was something shocking to me because um, the other context where I've seen touch being such a scarce service that we provide patients is in humanitarian context where you can't afford to have a private space. And so we tend to just avoid the physical exam and avoid the parts of the medical consultation that require the touch aspect or the physical examination part, right? So in those contexts, I'd say the physician often just makes a diagnosis, a working diagnosis based on what they hear the patients are telling them. You also don't have access to laboratory exams or imaging exams as much, and so there is a lot of what we treat is based on kind of I'm not going to say trial and error because there's enough evidence in what the patient's saying to help guide you, and then you can always get more tests, but it's, as I said, scarce in that setting too. Um, in my experience in the United States and Lebanon, the difference in access to I think I'd say in Lebanon the context or the culture is very much open, and we use the word touchy, right? So it's quite common to have a physician put their hand on your shoulder or offer some solace during their counseling on a bad for a bad test result or whatnot. And there is that element of exchange, and there aren't as many barriers to touch in Lebanon. In the US, it really depends on where. It's just so vastly different. Having practiced in New Mexico, Texas, and New York, New York City, I'd say New York City is probably where there were the most barriers, where there's, a lot of the individualistic and perhaps, if I may say, capitalism takes on a different, uh, or makes medicine take on a different meaning, or not meaning, but perhaps the attention that you get, you don't expect as much of that touch aspect versus practicing in a small town in New Mexico where patients are very much more open, want to be cared for in a way where you offer sympathy, empathy, uh, and sympathy and empathy for me are easier to provide when there's some element of touch, some element of closeness or proximity to patients. But again, I'd say in all the different clinical contexts or geographic contexts I've been in, I think the bigger factor um, for what defines how much touch is involved or interpersonal connection involved is more so where you seek care, if you're seeing a private doctor who has time, or if you're seeing an overworked doctor who has seen 20, 30 patients before you, and you're just, someone else on their list. And then in some contexts, there is a big cultural element, like what I'm starting to observe in Austria, where the culture doesn't expect for there to be as much. Like, I was having a conversation with some Austrian friends about, like, are you happy with how the healthcare, with the type of healthcare provided, with how your doctor approaches you, how they greet you, how there's not much eye contact, the type of, the way that they present information to you, because I've heard that across the board. I mean, this is just how doctors are in Austria, right? This is, and I think that's going to be a very interesting. It's already kind of stimulating my mind to think about where I can go with this from a research perspective, and the impact of the clinical patient interaction in this context.
So I'm going to pick up on a couple things because they really were extremely thought-provoking, and they tie into a general concept I have, which is, and I think this is also something you were saying, that in some cases you're using your hands to understand the body that's in front of you. And this was definitely the case before we had, very high-end diagnostic tools ranging from imaging to lab tests. We had to use our hands to understand the system that was in front of us, whether it's palpation or, just feeling skin tone to, our hands were a diagnostic tool. And you read some beautiful 19th century diaries of doctors, and they talk about their hands as their tools. And then their hands are also a way to create that connection that you've spoken so beautifully about. And you've also said that there's a prelude to that with eye contact and approach. And I just wanted to sort of maybe zoom in on this special case of pregnancy because you're living it now as a patient as well. And I think about these cases where, again, diagnostically, before ultrasound, your hands, and this is still the case for a lot of midwives, are the way to find out if the baby is in the right position, if there are any abnormalities, and so on and so on.